So before we talk to the guest today, a little about Hold Forum for Women. Hold was formed by four of us, Vasu, Devi, Anjali, and myself. But it belongs to all you women. It's a very small effort, so all women know that they are not alone during the different ages and stages of hormonal changes or life. Just yesterday, when I sent this info about today's session to a friend, she immediately called me and said she's going through things and she's so relieved to know that she's not alone. She's not the only one. Others are going through it too. So yeah, this is how we try to help. We have these sessions once every month. We try and cover a different topic each time with a relevant expert from that field. Very, very happy to share that Hold will be 1 year old next month. Those who are new and who could not attend our old sessions can find them on YouTube on Hold Forum for Women. Please go and check. I know all of you all are waiting to meet the guest. So I'll just pass on to Anjali now. Over to you, Anjali.
Thank you, Bhairavi. Good evening, everyone, and welcome to today's session. As you all know, today we will be talking about issues related to bone health for women who are aged 40 plus. We have a very well qualified and an expert and a very famous orthopedic who is having like over 16 years of experience in his field to share his expertise with us. And he is Dr. Manoj Pahukar from Alexis Hospital, Nagpur, India. Welcome, Dr. Manoj. It's a pleasure and honor to have you with us today. Thank you for joining us today.
It's my pleasure. Yeah. Thank you.
Thank you. After the whole day's work, you're still looking energetic and fresh. That's amazing.
Thank you.
And let me tell you that he has a treasure box of qualifications. He is a gold medalist in MBBS. He has done 2 post-graduations, one in the Masters in Surgery, that is MS Ortho from Nagpur. Another one is Diplomat of National Board, DNB Ortho from New Delhi. He is also a member of National Academy of Medical Science. This membership is gained by having a great professional achievement in the field of medicine and health. Dr. Manoj also gained a prestigious DEFI-sponsored fellowship in arthroscopy, arthroplasty, knee surgery from Ghent University Hospital, Belgium, where he has learned advanced techniques in shoulder and knee arthroscopy. He also secured European diploma, that is International Society of Orthopedic Surgery and Traumatology. He is also a faculty at Association of Osteosynthesis. It is called as AO National Faculty. He is a convener at Youth Serving Foundation, and he has also done many more short-term courses, which you can find the details on his website. He has 16 years of expertise in operating upon knee and hip joint replacement, shoulder and knee arthroscopy, and complex trauma. He has successfully and independently performed more than 5,100 orthopedic surgeries. He has received national recognition for performing maximum number of limb salvage cases with crush and vascular injuries in central India. And he has also conducted training programs in India and outside India. He has conducted a lot of research work in various fields related to bone and joint health, which he has published and he has presented. Currently, he's working at Alexis Hospital, Nagpur, India, as a consultant for joint replacement, orthopedics, orthoscopy, and complex trauma surgery. Like, for more detailed information about Dr. Manoj, you can, and also his research work, please visit drmanojpahukar.com or alexishospital.com, because as I told you, he has a treasure box of qualifications. With your qualification, with the list of qualifications, we know that you are so much interested in bone and joint health. So please share with us what inspired you to become an orthopedic.
First of all, thanks Anjali for such a kind introduction and such a detailed even all of these words. So thanks for that. Basically it's like after graduating and doing MBBS, I always wanted to seek my post-graduation in a field where I could deliver more to the patient. Like surgical field is a very dynamic field. It is all surgeon dependent field. And these are all gratifying results we usually get. Like the road traffic accidents, the injuries, they form one of the main part for the patient younger age groups. And in the older age groups as well, there are the joint replacements, arthritis problem, osteoporosis problem. So the orthopedics is one of the specialty where it's all the surgeon dependent, where the job satisfaction is more. So that has made me more inclined towards choosing this kind of surgical field, especially the bone and joint health. Yeah.
Okay. Thank you so much for sharing this information. Now I will pass on to Vasu, who will be asking you questions. Over to you, Vasu.
Thank you, Anjali. I was just counting how many times Anjali was saying also. When I first saw Dr. Manoj's qualification and he agreed to come, I really felt blessed and really felt joyful and happy that you could. I know that you're a very, very busy person and you could take out time and join today. So thank you very much for that. We have put some few questions ourselves among us and people who are, we speak to about the session. And those questions will be asked by me. And I request all the audience to start putting questions that they want to ask on the chat box, so that in the next segment, either you can directly ask Dr. Manoj or Devi will help you to ask the questions. So, Doctor, I'm going to shoot out with the first question without wasting more time, because we have so much information to collect from you and become more aware and more understanding about ourselves and our bone health. So, is hormonal changes and bone health, are they connected or is it a myth?
Okay, just before that, I would like to congratulate the whole team for conducting such informative sessions for especially the female health or the woman's health. And thanks Vasumati, Anjali, Bhairavi, Devi for giving me opportunity. I am certainly privileged to be on this forum. So going back to the question, it's like the osteoporosis or the whatever the thing which are talking about, the whether the hormones and the bone health is related or not. It is certainly very true for the females, the woman. It's because the estrogen or the estradiol is an hormone, which we all know that the females are having estrogen and progesterone. So this estrogen is one of the very important factor for the bone health. All of this skeletal framework is usually the bone metabolism is dependent on this hormone. So it plays a very active role in formation of bone, the resorption of bone. So it is one of the important factor. Then what happens during menopause? This estrogen, because of the lower functioning of the ovaries or the cessation of their functioning, the estrogen starts getting depleted. Initially during the perimenopausal period, it starts fluctuating up and down. There you get all these menopausal symptoms. And then at the end of menopause, it certainly vanishes out. So this hormone suddenly vanishing off from the bone will cause a lot of bone framework to get deranged. So that certainly changes the bone structures, especially in the females, because of this hormonal change which happens.